Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation. Hello, Megan. How are you?
Hi. Good. How are you?
I'm great. It's a great day. It's getting cold. It's fall. The hoodie sweater weather. It's fun.
It is. I was actually just complimenting Roxy because, when we record these, it's through Zoom, so I can see her. I was like, show me your top. And it's an Amazon dupe. So I wish you guys could see it.
Well, you look very nice in your sweater. You look very,
thanks. And this sweater I pulled out again. I was telling Roxy that I found this blazer that I never got rid of from the Gap from like my college days. And I think the sweater might be just as old. And I think I've only worn it like twice. And so I put it on today and my daughter was like, "Where'd you get that sweater?" I went shopping in my own closet. Good times. Good times. All right.
Like always, we're excited to be here. And we have today's topic. We're looking forward to sharing with you a little bit of a introduction to it. Our goal for today is to just bring you into what the conversation in a pelvic health evaluation looks like. So I know we've talked a lot about what we actually look at with your physical body. We went through head to toe, like why we look at certain things, what's important, all that. But sometimes it can be scary because we're not used to talking about these different things that are happening. And so we want to run through what the conversation looks like when it is a clinician and a patient in the room before that physical evaluation, what the narrative is and what the questions are and why we're asking those so that it's not a surprise. We don't like surprises. Not those kind of surprises anyway.
Yes. I think, like Roxy said, there's lots of reels out there and different things about what we look at, but it's more of like the actual physical. And I think sometimes people are surprised by some of our questions, and it's very comprehensive questions. And also, at least for Roxy and I and most pelvic health therapists, like nothing makes us uncomfortable as far as like, we can talk about pretty much anything and we need to know some things. So some intimate details and stuff like that is sometimes hard to share. You may not feel comfortable sharing that the first visit, but our goal is just to make you realize that, or help you realize that we are your ally and your as in part of your health journey, and that knowing some of this stuff that might feel like it's more private, we are your people to talk to about it. So it's going to be fun to kind of share about what our questions look like when we are doing an evaluation or not even evaluation, but as we're continuing our care with somebody, like constantly revisiting these questions. And you might be surprised by some of them. And if some of them bring up questions or realizations in you, just one more reason why maybe you should go ahead and go get a visit with a pelvic floor therapist. So Roxy, start us off. Or I guess, am I starting?
No, I'm starting.
Okay.
I'll start us off and you chime in and then we'll switch and we'll go back and forth. So the first thing is a little bit obvious, but there's some little gems intermixed in it. It's just our health history. And I think sometimes people come in and they're kind of expecting maybe a rapid fire of all the symptoms that they've maybe said ahead of time on like maybe a questionnaire that's sent out beforehand, which if you get that, that's great. That just kind of gives us a quick spiel of what you're going through. So we have no idea. So that when you walk in the door, we have no idea. So you might answer a few questions ahead of time from your visit, but then when you get in the room, we're going to review a lot of that and we'll go over it. And so the first is just your health history. And so these would be symptoms of other things. And I typically, Megan, I don't know about you, but nothing's really off limits in this. as far
Yeah.
as, people are like, oh, when I was little, I had my gallbladder taken out, I mean, just anything like that, that can help us if there's scar tissue somewhere in your body for that. If there's any kind of chronic autoimmune.
Well, with the health history, yeah, and different, you might think like, yeah, I'm just going to mark these like low blood pressure, blah blah blah. But like Roxy just said, we, at least the way that her and I practice, really like to comprehensively go through this because, like she mentioned, there are often things that come up in conversation that our patients never realize could be part of what's happening, and it most definitely is. And then, like she talked about the autoimmune piece, when we have people come in and they're telling us a cluster of symptoms that we are like, it cues us off to things. And we may not say it right away, but I'm very much paying attention to those trends. And then I kind of watch to see then what I find when we do the hands-on work. And I can't tell you, I know, Roxy, you're probably the same way, how many women we end up sending to the doctor and, hey, we find out they've got thyroid disease or they have thyroid dysfunction, or, hey, we find out they've got low testosterone or low estrogen or low progesterone, like low vitamin D, stuff like that, by them just telling us, gosh, I'm so tired. And in today's world, we are kind of brushed off when we say things like that because everybody's a busy mom and a busy whatever, going to work, and just life is busy and fast. And so it seems acceptable to be tired and have brain fog when it's not. So yeah, I love the health history part. I don't know about you, Roxy. I mean, early in my career, I would just be like, look for the main things, do I need to make sure that diabetes, all that kind of stuff, which we still do, but now I'm just fascinated by it. So yeah.
Yeah. It gives us, like she said, a comprehensive look at what's going on. And it might not be something that's terribly pertinent in that sentence, but then as we get in, like she said, we start looking, then it helps us put a lot more pieces to get together and connect a lot of dots. And so part of that health history then is, just the general, like, heart, breathing, literally anything head to toe, scars, surgeries, procedures, diagnoses that you've had in the past, just anything you can think of that's general health history that you maybe wouldn't expect us to ask. It's gonna be probably part of the conversation, and we don't brush those off. Also, part of that health history then is for females, your pregnancy history, and that isn't just, oh yeah, I've had babies, even if it was 30 years ago, we're going to ask how many, what type of delivery, if there was a history of infertility, miscarriages, just different parts of that journey. If there was a traumatic birth experience that, turned into a C-section, or you had a VBAC, or whatever that is, we're going to ask some details about that, because that also kind of tells us what your body's been through. And we appreciate that. Another part of just health history are things that would maybe stress the system. So things like smoking, weight gain, weight loss. What else,
Sleep,
Megan, is kind of on that? Oh yeah, sure.
Yes, sleep, maybe a recent trauma, past trauma, stuff like that. And of course, those sorts of questions, again, that might not be something first visit that we're always reading the room and knowing, maybe somebody's not comfortable talking about that. Maybe eventually they will be, but it's just something on our radar, because that definitely, like Roxy said, it affects our healing. It affects how we respond to others, how our body responds to touch. And so one of the things that we're highly trained on is to be sensitive to those things, trauma-informed care, all that kind of stuff. And early on, my intake did not have anything on there about stress or sleep or anything, but now it's definitely on there because it's just so common in our world to have this high stress. The box is clicked high and the sleep box is clicked as poor. And it's a combination for disaster. So it's definitely something that, we like to touch on.
And then kind of the last part of that is we wanted to highlight was pain. As part of the health history. And that isn't just pelvic, that's any kind of pain. I had a gallon yesterday that just has gotten a bunch of testing done because she just has chronic headaches and migraines. And we then appreciate that changes how her body adapts and responds to change anywhere in the body. And so just any kind of pain, if it's, it can definitely fuel and feed into pelvic dysfunction. And so even if it's a total knee replacement or, arthritis or things that don't seem like they would really be connected, we're whole people. So we ask that.
Yeah, I love chatting about this, especially if someone calls in and I tell them kind of what to expect on the intake. And I say, like, on the pain section, put any pain you have. Pain, if you think that it doesn't relate at all, I want to know about it because it does relate, because it could be pain anywhere. And and if your nervous system's and your body's having to protect somewhere, it's going to affect the rest of the body and how pelvic floor is functioning. And we know how closely the pelvic floor and the autonomic system, I mean, they're practically intertwined. So yeah, it's definitely important. And then, yeah, I mean, Roxy, I know you probably get the people that say, oh, well, I've got the shoulder pain, but I know that's not what you do. So, but yeah, I've had this right shoulder pain and guess what? Then they have left hip pain. And we know that there's this like fascial sling system. And, I take note. I said, well, actually, you know what? We probably will address that. And it might not be priority number one, but it's on their list of things that we're going to get to. So it's cool stuff.
Yeah. We aren't pelvic floors. We're physical therapists first.
Yes.
Pelvic floor rehab second.
Yes.
And so we definitely have, we can treat it all.
Yeah, exactly. That's what I always say. Some will be like, they'll come in, it's like maybe their fifth visit for pelvic floor. They're like, I'm asking them their subjective. They're like, well, I know I'm not here for this, but I have da 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 da. And I'm like, well, I mean, I can give you some stuff for that.
For sure.
They're like, oh my gosh, thank you.
All right. Well, I think that kind of wraps up health history. Unless there's anything else, Megan, that we missed
I think that's good. Yeah, we can move on through. So let's talk next about the urinary health section. So typically when we go through and ask questions about that, often the most common thing people might be coming to us for, one of the most common things is urinary leaking. And urinary leaking can look different. So there's different kinds of urinary incontinence. We have urge urinary incontinence, which is that whole, like, you're on the way to the bathroom and you start to pee on the way there, or you start to take down your pants and you start leaking. So that's urge urinary incontinence. Stress urinary incontinence is the whole leaking urine when you laugh, cough, sneeze, jump, that sort of thing. And then we have mixed urinary incontinence, which is a blend of both of those. So both of those things happen. So anyway, we're going to go through and we're going to talk about which one it is that you have. And we could dive more into that. I feel like there's a whole podcast episode that could be on what each one of those are and why and yada, yada, yada. But this episode is we're just focusing on what we're going to talk about. So I'll stop with that. Then we're going to go through and we're going to ask you things like, do you have a strong urge to urinate? Do you go from like nothing to 5-alarm fire? That is where we're looking for. And you may not leak, but that you go from no signal to you better get to a bathroom right then and there. So we talk about just urge in general. Of course, we go through and we talk about volume of leaking, that sort of thing.
And I would add to that, just the leaking side of, well, a lot of times we ask too, like, what's going on right there? Because sometimes is that how it is every time you have to go to the bathroom? Like, we're going to dive deep into that because sometimes it's circumstantial or situational. And so we are going to ask, we're going to keep asking the questions, and it's not because we're nosy or because we want you to feel mortified that you're talking about that, but just, we really are trying to get to the root of it and take away any little thing that would be contributing to your symptoms.
Yeah, exactly. And then we're going to ask things like, how often does leaking happen? Does it mainly occur during the day, at night, blah, blah, all that kind of good stuff. We're going to ask you about if you use a protective device. Do you use panty liners, pads, incontinence briefs, that sort of thing. Then we're going to also talk about, do you have difficulty starting your stream? Once you start your stream, is it slow or intermittent? Does it like flow and stop and flow and stop? Do you have to strain or push to feel like you have to urinate? Do you have post-void dribble when you stand up? Do you have a little bit dribble out? Do you have burning, blood in your urine, discomfort or pain? Do you have recurrent bladder infections? Do you have difficulty stopping your stream of urine? If that happens, again, let me just do a caveat with that. We do not want to be stopping our stream of urine while we're going to the bathroom. That will cause you guys. But sometimes we ask that question because we want to know, if you had to, could you?
Or I would say people are doing that anyway.
Yes.
Like I feel like people are curious and they check and they'll say, I try and do it and it's like, no, like we're not recommending that.
I don't want that.
People are usually doing it when there's problems because they're trying to diagnose and figure out what's going on themselves.
Yeah. And we call it the stop test if we're going to have you do that. And then also too, just that feeling of like, do you have a complete, like, is your bladder empty? Do you feel like you've had a complete like void? Because a lot of times we can have retention. So we also want to know, how often do you go pee at night? So this is called nocturia. Do you sleep through the night? Do you wake up once, twice, 3 times? And we have age categories. And ultimately, you should not wake up, depending upon your age, we shouldn't wake up to go pee at night. And again, would be something we would dive deeper into. There's definitely some outliers with that, pregnancy, stuff like that. And also, like I said, there's age categories where it kind of breaks it down. But if you're young, sleep through the night. And then we're going to go through of frequency. We're going to find out, how often are you going to the bathroom? We should be able to kind of make it that 2 to 3 hours. If you're drinking a ton of fluid, then of course you're going to pee more frequently. But we want to know that when you go, if you're going quote unquote frequently, do you have a full bladder when you go? Or are you having that strong urge and you sit down to go and nothing comes out, or it's like it dribbles out? That's where frequency, that's what that is. So I had people say, oh my gosh, I'm going every hour. I've been drinking a lot of water. I'm like, great. When you sit down, is it a full bladder? Like, is it 8 Mississippis? They're like, yeah, it's like 15. I'm like, okay, well, your bladder's full. But when they say I'm going every 30 minutes to an hour and I go sit down and barely anything comes out, that's a misfire, missignal, like your bladder, like that's not what we want. And that's what we're looking for. And that's why we're digging in with questions about that. And then we're going to ask you things like, how much fluid do you drink? How much caffeine do you drink? How many carbonated drinks are you having? So we're going to try to also figure out, like, could there be a bladder irritation thing happening? But this is just like the tip of the iceberg of where that's why we have these lovely intakes. And then we dive into it even deeper, and it's super comprehensive. So that is kind of, unless Roxy, you have anything to add, that kind of goes over what we're talking about when we want to know things about urinary function.
I think I've learned my lesson the hard way of, if I just sent an intake and someone says, oh, I don't leak. And I've learned then that if I were to follow up 9 times out of 10, I follow up on that. And people say, oh no, I don't have incontinence. I mean, sometimes I leak or sometimes I leak a little bit when I cough or sneeze or whatever. And it's like, that's leakage. Like that's incontinence, and in my head, just because like maybe our definitions aren't matching or whatever. And so we've just learned there shouldn't be shortcuts. If we're going to do our patients as the best care, basically we have to dive deep into this. And so anyway, that's kind of been my lesson learned the hard way of, well, people are going to answer honestly on a form, and not that anyone's intentionally lying. They just maybe don't understand the value of the question.
Totally. I think that a lot of people either don't really understand that they are leaking, or maybe there's like shame around it, and they kind of hold back, where they might put no on one answer, but then when they realize when the question's a little formed differently, it's a yes. And listen, we're here to have you guys come in and not have any shame around anything that's going on, because it's fixable for sure.
Okay, so we're going to move on to the next function of bowel. And this sometimes I think can be a little bit more uncomfortable for people to talk about. I just think poop in general just feels a little bit more taboo. I don't know what it is.
Well, and they also, I think it's becoming more known, but I think a lot of people, then they're coming in for urinary leaking, and they're like, why are we talking about my bowels? And they just don't realize it's like a major player in why you might be leaking. So we love talking about poop.
I'm glad that you pointed that out, though, because it's a lot of times can be the make it or break it between success and failure of urinary symptoms. So we always, always, always ask about this. If you're going somewhere and someone hasn't asked you about your poop, like there's a huge problem there. So we are always going to ask these questions.
One thing I just want to say real quick, as you said that, we actually had somebody here recently that called the clinic, and she was actually doing pelvic floor therapy somewhere else, but she wanted to come see us to take care of her like poop problems. And I was like so confused by that because I thought, well, but like you're already seeing a pelvic floor therapist. And so that just goes to kind of show you that, yeah, like, well, either whoever she's seeing maybe she's not trained in it. Like maybe, well, if she's trained in pelvic health, you're trained in being able to help somebody with their bowels. But maybe, there's different scenarios with that. But that just, I don't know, when you said that, I was like, that just happened just last week with us where we were kind of, they like made a step back. We're like, well, we're happy to help you with that. But if you're going to come see us for that, we'll just take care of everything.
Yeah, let's do some follow-up questions maybe here.
Yeah, I know. I had lots of questions with that, but I didn't take the call. So I was like, well, whatever.
Well, so jumping into that, this is gonna kind of mimic urinary. Essentially, we're gonna ask about leakage and then retention. So we're gonna ask if you're unable to hold your bowel and you're having accidents, if you're having staining like in your underwear, if you're having difficulty even holding gas, like gas is going to slip a few times for the average person. But if it's consistently, you're noticing that inability to hold your gas back, then that shows that that area is not working well. Some other things that maybe aren't as obvious are just things like having to wipe over and over and over excessively and just never getting clean, feeling like you're getting clean. And then we kind of go to the other side of that then of just the constipation and not being able to empty and it feeling stuck. If there's pain with that, if you're having to strain quite a bit, that's going to lead us also into some questions about, obviously, huge questions about hydration, diet, laxatives, if like medications, what kind of aids you're using, just that the lead up to the bowel, not just the act of having a bowel movement, but the lead up to that. And then kind of like Megan had talked about with urinary, we're going to talk about the frequency. If you are going a lot throughout the day and there's small amounts and it's not just a normal bowel that's leaving and, an appropriate volume, then, that's telling us something isn't quite right also. And so we're going to dive deeper into that and ask about, well, are you having an urge? Are you just going because you're nervous about leaking? Are you having to kind of brace your perineum or manually assist that? Like kind of the details. We're going to get into the nitty gritty of when you're pooping. Tell us exactly what's happening and how that action is being completed.
Exactly. Like even like, do you use a squatty potty? How are you sitting? How are you breathing? What's your posture? It really is. We're going to show you a picture of all the different like bowels, and you point out which one you feel like it's solid, or is it pebbles, or is it loose? So it is really telling how our gut health and how our health in general is through how we poop. And also talking things about, do you have a routine in the morning? Just so much. You guys, this like, man, when you go through a pelvic health evaluation, it is so comprehensive and opened your eyes up to a lot of things. And I can't tell you how many times people say, like, I didn't even know that this was part of everything. Or they'll say, we'll get to the piece about bowels. And they're like, oh, yeah, I'm constipated. I've been that way my whole life. Like, what? Oh, yeah, I just, I'll go 3-4 days, then I'll go, no. And then we get them going.
Well, and I think one area too of when we start asking more specific, pointed questions, it's amazing at how many people maybe don't realize how dysfunctional their body is working and is dysfunctioning throughout the day. I was going to say functioning. Yeah. I'm like, it's functioning, but not well. Yeah. So just even like, oh, I didn't realize that was not how it's supposed to be, because maybe that's how they've always been, and no one's talked to it. This might be the first time they're talking about it. So they don't even know that I mean, it's not like you always sit around and talk about your poop with your friends. I mean, Megan and I do, but
Sure.
no,
I know.
I'm just kidding.
I would happily talk about my poop. Actually, I probably would talk to you about my poop if I had a problem. But yeah, it makes me laugh when we're talking about this, because years and years ago, my dad had his colon tie a knot on itself. And it was, I mean, that can kill you, but it was super scary, but he had to have it surgery, and then and nothing was functioning well after that. And so he had to briefly have like an ostomy bag. And so that's the bag outside of the body to capture the bowel. And then he had that while his intestines and everything was healing, and then they reversed it. And so it's like, till this day, in my family, pooping is like the most glorious thing. And like and my dad, every time, it's just like, I'm so grateful that I can poop. And we all are, and so it's always, we laugh because we all are on vacation. It's such a topic of conversation. Like, did you poop today? So we'll do a whole podcast on pooping and all of it, because
it'll be glorious. It'll be great.
I know. Yes. So we got off topic there, rabbit hole.
I mean, kind of. Is it really off topic? I think that was about it. Maybe incomplete emptying was I think the only other one I didn't really throw in there yet, of just feeling like or if you're in a hurry, even. Sometimes I have a lot of questions about that. Like, are you in a hurry? Are you giving your body time, or are you just like, hurry up and go? Or are you nervous when you go into the bathroom, like that stage fright feeling? So just that ability, like, are you able to completely empty, or is there still some in there and then you have to go back later, and then it turns into this frequency thing because it's just not emptying. It's not given the chance. So
yeah, this is a common theme, I feel like, for peeing and pooping, that we're in this big rush. Either we like don't stop to go pee or poop because we think we don't have time, or then we go in there and we're just rushing, when really, if you just slow down, it doesn't take all that much longer, and you're allowing the actual function of your pelvic floor and your organs to function properly. And then so we have this like rushed mentality, the world we live in. We also have been kind of sold this constipation or not pooping is just kind of okay. It is what it is. Or we're given the IBS diagnosis when we might go to our provider and there's not any further digging to what could be going on, which typically it's maybe a nutritional thing or a food sensitivity thing or whatever, gut health. So that's combined. So it's like we're rushing. Then we're combined with just our world that kind of brushes it off. And so then it ends up being a recipe for disaster. And again, that's just something that we're going to really try to help and guide you to the right people, and not accept the I'm still only pooping once every 4 days type of thing. Oh, and little pearl, you could be pooping every day and you still could be constipated. So I just needed to make sure we got that in this episode.
Yes, I'm glad you dropped that bomb right there. Just leave it at that. We'll move on now. At that.
Yep. Enough said. Okay.
Good conclusion.
So from there, let's talk about sexual function. And this area, we want to know things like, do we have pain with intercourse? And with that, is that with initial entry, or is that with deep penetration? And not just with intercourse, but do you have pain using a tampon? Do you have pain with your pelvic exam when you go to the doctor? So we're going to ask pretty in-depth questions with that. Does the pain linger? Does it start and go away during, afterwards? Does the pain last for days, hours, whatever? We're going to go through all of that. And then we're going to know things like, we want to ask things like, do you have pain with orgasm? Do you have difficulty achieving orgasm? Which I think a lot of women are kind of surprised when we ask those questions. And also too, like if we're seeing a male patient, it's the same thing. We're going to ask those same questions because it opens the door up for them to finally feel comfortable to maybe talk about that, especially women with a difficulty achieving orgasm, and opens the door up to like a further conversation about that, education of their body better. Maybe we need to talk about sex therapy. being able to kind of guide them a little bit further on that. And honestly, like I love those conversations because you can see women literally kind of like a sigh of relief or a weight lifted off of them to be able to just have somebody to talk to about that. And then we're also going to go into like vaginal dryness, painful periods. And again, people are shocked that we're asking those questions. They're like, yeah, I've had vaginal dryness. That's just the way it is. I'm getting older. Well, yeah, you are, but there's a reason why. And we have options hormonally or not to provide or recommend that can make a huge difference. And then painful periods. Yeah, I've always had painful periods. We've been groomed to believe that we should accept these painful periods. And that's another kind of like bomb drop. We shouldn't be having terribly painful periods, maybe a little light cramping, but these sorts of periods where you're missing days or so bad you're vomiting or going to the ER, that's telling us something is going on deeper. And then we're going to help dig into that. And that is something that I think is really cool when we have somebody come in for maybe just urinary leaking as their primary concern, but then they have these other things. And as we're working on their pelvic floor, they come back and say, hey, I just had my cycle and I had no cramps. Or I just had my cycle and normally I have lower quadrant pain when I'm ovulating. Didn't have that happen. Or, hey, guess what? It was the most amazing thing. I had an orgasm and it was the best orgasm I've ever had. And, it's like, that's amazing. It's because those things get better when we're working on the pelvic floor. So the sexual function piece of this is just, again, it's pretty comprehensive and the conversation keeps going. And we are definitely happy to talk about that. And it doesn't make any of us feel uncomfortable at all. I'm happy to talk about it. And sometimes I have to almost like hold myself back and be like, okay, maybe I'll ask that on the third visit. But with that too, as far as like for men's health goes, with men's health, really urinary questions are the same. Bowel questions are the same. We all have a pelvic floor. It's very, very much the same with a little, differences. But we're going to ask things like erectile dysfunction, painful ejaculation, painful erection, pelvic pain, prostate disorders. We're going to go through all that as well if you're a male coming in. And so I think we wanted to make sure that we talked about that because ladies, if you're, have a husband that's talked about these things or experiencing these things, a lot of times, even more so men, they don't know where to turn or who to ask. Typically, it's like they go to the urologist, which is fantastic, get checked for all the scary things. But then when those come back normal, it's like, well, what do we do with this? I just have to live with it. And no, you do not. Also, we're going to talk about testicular pain, those sorts of things. So I think outside of that, we also chat about, do you have pelvic pressure? So we're asking questions about prolapse, which typically that's kind of brought up sooner in the conversation. A lot of times if women are coming in for prolapse, like that's brought up right away with probably in the pain section. Even if you're not having pain, it's like that's what they bring up. So we're going to go through that. But yeah, that pretty much is our questions superficially in a nutshell. And then from there, based off of the answers that are given, then we have follow-up questions even deeper. So Roxy, do you have anything else with that?
I would I think that sometimes all those questions aren't always all asked the first visit either.
Yeah, for sure.
And then we will always, I think, just know you don't get out of that first visit and that's the end of the conversation. Like we're going to circle back to it. We're going to continue those points that we're concerned about, those points that are symptomatic. We're going to keep coming back to that. And we write these things down. We're sitting there typing, we're documenting so that then in 3 weeks down the road, we can say, hey, the first day you came in, you complained of this, this, and this. Not complained like a bad thing. Just that is your complaint. That's what's not happy. That's why you're coming in. But these are the things that you indicated. How are these going? And it might not be 3 weeks, but sometimes we try and get the low hanging fruit right away. We try and hit the big things, but then there's these other things that we're concerned about that we're definitely going to circle back to. So it's not a one and done conversation. You don't get out of that path. You don't like get through that and just say it once and then I mean,
Yeah.
not to make it sound scary, but just to let you know, like, it's a safe place to talk. Like Megan has hinted at the beginning, it's conversations we literally have all day, every day, that we appreciate, and we understand that this might be the first time that you're talking about this in regards to your symptoms and how you're living, but it's important and it's vital
Yeah.
to meet the goals that you and us want for you.
Yeah. Yeah. I think we constantly, even though we are not saying it at every visit, us as the providers are going like, like we're in the card catalog at a library, it's like we're going through all the different things, like we're circling back in our brains. We're looking for patterns. We're looking at the connections that are there. And we know that if we take care of A, that actually is going to help with C and D. And that is a cool thing to have happen. And then also too, I know how Roxy practices in her clinic, how myself and the other clinicians are at our clinic. We are not just trained on the standard, like just pelvic floor training. We have this wide, vast training in hormones and trauma and our nervous systems and how mental health can affect these things, how cultural competence with these things, the physical, just everything. And I think that that's a really beautiful thing when you can take in and you can be able to identify things where we are, yes, we're not nutritionists, but we also are very aware of what things can be added in to be helpful. And then we also know how to who to refer. And we have providers that we trust and know that we're going to get you to. So it's like, yes, you're coming to see us, but then this can open up a whole new world of other people that can also support you on your health journey that you're on. And they all align, and we're all allies to each other. And I think that that's one of the things that is so cool because it's multifactorial for sure. Yeah.
Well,
gosh,
cool.
just we love our jobs. And I know this was actually really fun to talk through. Again, like, gosh, we really do ask a lot of questions, but it's fun to talk about. And yeah, I was sitting here thinking, like, just as in my head of some of how I've personally evolved as a practitioner. Of when I first started, I would be asking, turn red in the face and stumble over my words of like, oh, do you have pain with intercourse, and being like shy about it. And now I'm like, all right, let's talk about it. And I love it. So very good.
Cool. Well, hopefully we started that conversation. Hopefully it keeps playing in your mind as far as just some little things that we touched on, or if you've been nervous about or just curious about what would that look like, what would we talk about? We laid it out there, folks. And so there's no need to fear. That's right.
Can't wait to continue this conversation, and hopefully all of our listeners will do the same.
All right. See you later, Megan.
Bye. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.